Now, two questions. One of them is about 40 or 34-year-old man has burning, numbness, and tingling of the dorsal aspect of the first web space of the left hand. The symptoms frequently occur when he wears a wristwatch. There is no history of trauma. Which of the following is the most likely diagnosis? First, A. Anterior interosseous nerve syndrome. B. Posterior interosseous nerve syndrome. There is pronator syndrome. There is radial tunnel syndrome, and E is Wartenberg disease. The site is E. The most likely diagnosis for this patient is Wartenberg disease or compression of the radial nerve at the wrist. This condition is characterized by burning, numbness, or tingling over the dorsal aspect of the wrist web space. Causes of nerve decompression typically include a direct blow to the wrist or too tight a cast or band such as wristwatch. The nerve can be tethered whether it pierces where it pierces the fascia between the brachioradialis and extensor carpi radialis tendons. Patients with Wartenberg disease may be misdiagnosed as having Dr. disease, tenosynovitis of the first dorsal compartment because of the similarity of symptoms. Anterior interosseous syndrome is characterized by weakness of pinch of the thumb and index finger caused by weakness of the flexor pollicis longus tendon of the thumb and the flexor profundus tendon of the index finger. Pain in the proximal forearm that increases with motion is also characteristic. Posterior interosseous syndrome is caused by compression of the radial nerve in the proximal forearm. Wrist extension results in radial deviation because of paralysis of the extensor carpi ulnaris. There is loss of extension of the metacarpophalangeal joint. There is no associated sensory abnormalities. The pronator syndrome is characterized by pain in the proximal volar forearm and loss of sensation in the thumb, index, and middle finger. Radial tunnel syndrome is characterized by pain that occurs with extension, supination against resistance or passive flexion and pronation of the wrist. Pain is localized just below the elbow in the extensor mass and along the course of the medial nerve. This is according to the first question, which is about a 34-year-old man. The other one is a 45-year-old woman who has pain and numbness in the right hand and forearm. There is no motor disturbances. Siemens Western modified testing shows decreased sensation in the index and long finger, thumb and palm. Funnels and tunnel signs are negative over the carpal tunnel. These findings are most consistent with which of the following? First, anterior interosseous syndrome. It was the same choice for the first question. The second there were, or B was there, and posterior interosseous. Here there is C5 cervical radiculopathy, C carpal tunnel syndrome, D cubital tunnel syndrome, and E is pronator syndrome. The correct answer is E, pronator syndrome. Although the sensory and motor deficits of the carpal tunnel syndrome and pronator syndrome are similar, the sensory deficit within the palmar cutaneous region best differentiate pronator syndrome from carpal tunnel syndrome. The patient has findings consistent with pronator syndrome or compression of the median nerve within the proximal forearm. Sites of potential entrapment of the median nerve include the ligament of Struthers in the distal arm, the serous fibrosis at the level of the elbow, the pronator teres muscle, and the arc of the flexor digitorum superficialis muscle. Although symptoms are similar to carpal tunnel syndrome, sensory findings typically occur more proximally. Symptoms can be reproduced with active elbow flexion, with the elbow in pronation, resistant elbow flexion, or resisted pronation with flexion of the wrist phalanx. Signs is negative in most patients with pronator syndrome. Anterior-anterosseous syndrome results from compression of the anterior-anterosseous branch of the median nerve in the forearm. Affected patients have poorly defined pain in the forearm and weakness of the profundus tendons of the index finger and the index and the flexor pollicis longus tendon, but no sensory deficit. Cervical radiculopathy at C5 is characterized by radicular type pain in the lateral aspect of the upper arm and forearm. Cubital tunnel syndrome is caused by entrapment of the ulnar nerve in the region of the elbow. Affected patients have sensory deficit in the small finger and ulnar aspect of the ring finger. So those are two questions. I tried to combine them together in order to know more about and to compare the information about those. Please make like and subscribe to my YouTube channel, and share this video with your friends who wants to submit to plastic surgery exams. Subscribe and give me a comment about your questions, and will help you as much as I can.